Hi there. Hi, it's been a long time. Welcome back. Welcome back. Yep, just come on in. You can take a seat. Okay, so how have you been for the past year? You've been keeping well? Perfect. Yes, I have too. Thank you very much. Okay, so we are back with an annual checkup, so it'll be quite detailed. I'm sure you're quite familiar by now. Pretty much the same kind of tests that we did last year. Okay. Would you like a quick run through of what to expect today? Okay, so listening to your heart, listening to your lungs, temperature, blood pressure, eyes, ears, your body movements and body strength, balance, skin, scalp, hands and nails. That's pretty much it. Okay, but what we'll do is just start off 5 minutes with a little bit of a catch up and a few questions. Okay, great. Let me just get my keyboard. So I don't know if you remember, but in this clinic we use a wireless keyboard. Okay, so looking at the records that we have for you, let's just see if there's anything that needs updating. So if you could just go ahead and confirm your name and address. Perfect. Your email address, have you changed it since you were last here? Okay, or a contact telephone number. Okay. Right. So, have you been taking any different medications, or have you stopped any other medications since I saw you last? Okay. When did you stop that? Did you find that it wasn't working for you, or did the course just come to an end? Okay, yeah, so all healed up. Okay, perfect. And you haven't started taking any other medication? Perfect. Alright, have you had any illnesses in the past year? Anything more than, say, a common cold? Okay. So it's coming up to flu season. Have you booked in your flu jab? Yep, okay. It has been a strange year. Really not the kind of year I was expecting, but there we go. It's been a strange year indeed, but I trust that you've been keeping yourself safe. Yeah? Okay. Alright, what else? Yeah, just looking at the computer, it looks like you had a recent injury and you suffered a facial trauma. Yeah, and did you see anyone? Yeah. Okay, that was the orbital exam. Yeah, okay. How did that go? Good, yeah. They are quite interesting. I've sat in on one once myself and watched just to learn. They are a little bit different to a regular typical eye exam. Okay, but that's all better now, is it? It definitely looks better. said that you were having problems sleeping, and I recommended and referred you to the sleep clinic. Did you attend that appointment? Okay, and how did that go? Yeah, did they teach you some different kind of sleep hygiene habits? Yeah, okay. Do you find that that's helped you? So I think last year you said it was quite bad, your insomnia. How would you kind of rate it now on a scale of 1 to 10? A 7, a good 7. Okay, yeah. At the sleep clinic, did they teach you or introduce you to the concepts of ASMR? They did. Okay, great. And have you found that's been helpful? Yeah, me too. Personally, I find that I use it every day, either to help me sleep at night or just to relax and calm down during the day, as well as, of course, meditation and reading can also be a very good way of tiring out your eyes before bed. So I'm glad that's improved for you. Okay, any other major updates in your life over the past year? Or maybe in your family? So any diagnosis in the family? Cancer? No, good. Heart disease? Okay. Anything else? Okay, good. Right, I think that's all for the questions. I don't want them to drag on too long. I am aware that I tend to talk too much and keep my patients around for far too long, so we will cut that short there. But if you can think of anything else throughout the session that you'd like to tell me about, then feel free, okay? Perfect. Alright, so very, very simple to start with. I think we'll just listen to your heart. Okay, yeah, so if you like to unbutton, it would help if I held it the right way. Okay. Alright then. This is a little bit on the chilly side, okay? You ready? Alright, so if we just stay quiet for a moment. Yep. Okay, good. I'm just gonna count for a moment, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, let's just pop those out because they're quite tight. Yeah, that was good. Nice, normal, regular heartbeat. No sign of a murmur or any irregularities, so fantastic. If we move on now to listening to your lungs, okay? So yeah, again, leave your shirt unbuttoned for just a moment longer. Okay, So just nice natural breathing, okay? Just to begin with. Okay. Okay, good. Yeah, let's go to the other lung. Okay. If you could go ahead and breathe deeply for me now. Inhale. Hold. And exhale. Okay, one more time. Inhale. Deep. Hold. Exhale slowly. Good. Okay, other side. Again, deep breath. Inhale. Hold. Exhale. Lovely. One more time. Inhale. Hold. And exhale slowly. Perfect. Okay, that's great. You're not a smoker, are you? No, I didn't think so. They sounded really full and healthy, okay? And you're breathing nice and deeply into them, so that was really good. Thank you for doing that, okay? What we're gonna do now is your blood pressure, okay? So if you just want to slip out one of your arms, either one is fine, whichever one. There's a table over this side, so maybe that one. Okay, I'm gonna get the blood pressure cuff. Alright, here we go. So thank you, you're ready. Let's just go ahead. Wrap that round. Okay. Rest that right there for me. Just pop this back in. Okay, so just try to relax. And I'm just gonna pump it up, okay? Okay, yeah. Okay, sounds fine. It's just good. Okay, perfect. You can slip your arm out. Great. Okay, probably don't need that again. Okay, so next, if we could just take your temperature. I'm gonna put my gloves on now. So I have a thermometer that goes in your mouth. It's an oral thermometer. Is that okay with you? Yeah, okay. So it is regularly disinfected, so don't worry about that. If you'd like to go ahead and open your mouth. I'm just going to pop this under your tongue, so if you could lift your tongue just a tiny bit. Okay? Yeah, that's good. Perfect. Just give it a second. Okay, perfect. 36.8, which is completely fine. Anything sort of 36 to 37 is good. Okay, right, so what we can do now is just have a look at your skin. So I'm gonna look at the skin of your face, the skin on your scalp, and the skin on your hands. I've already kind of just seen the arm that we did the blood pressure on, and that looked normal. Okay. So is it okay with you if I come a bit closer? Okay. Right. Okay. So I believe last year you said that you don't suffer from any skin conditions generally. Is that right? Maybe acne a little bit in the teenage years. Okay. No eczema. Okay, yeah, the skin on your face is in very good condition. I can tell that you take good care of your skin. Yeah, okay. And you moisturize daily, I assume. Yeah. If you wouldn't mind just looking up. Okay, good. And then if you wouldn't mind turning your head side to side. Okay. Okay, great. Now, if you wouldn't mind tucking your chin to your chest, bringing your head down for me so that I can have a look at your scalp. Okay. That's it. Good. Okay. Yep, just tuck your head down a tiny bit more. Okay. Good. Okay. Have you ever had any itching or some kind of soreness on your scalp? I only ask because I'm noticing a couple of slightly red patches. It's ever so slight and it's only in a couple of places. It seems to me that it could be, maybe it could be that some kind of product you've used has irritated your scalp, or it potentially could also be a little touch of psoriasis, which is like a fungal condition, and you can get it anywhere on your skin really, but it's quite common in your scalp. Yeah, just turn over, turn to the side. Yeah, okay, the other side. Okay, I think what we'll do just to nip this in the bud, okay? Because you said it's not itchy, so it's not really causing you a great deal of harm, but if we can just nip it in the bud. So I'll prescribe you a special kind of shampoo, okay? Just use it once a week, but when you do use it, leave it on your hair for a good 10-15 minutes before you rinse it off. Yeah, so that should get that cleared up in no time. Okay, great. Alright, if I could just have a look at your hands. Yep. Okay, good. And if I remember rightly, did you say that in your day job you spend a lot of time outdoors? Okay. The other hand. So your hands are a little bit dry, which again, if I remember, I think that we had this problem last year. Alright, So are you moisturising your hands regularly? I know you're moisturising your face, that's great, but if you could also be moisturising your hands, especially since you're spending quite a lot of time outdoors and we're kind of moving into winter now, and the winter can be quite harsh on your skin. So if you can just try to moisturise your hands, I find that bedtime is a good time to do it. Because you know that you're going to be asleep for the next 8 or so hours, so you're not going to be needing to use your hands, so you can put a nice thick layer on and know that it's got plenty of time to soak in. With your hands, if we could also just do your oxygen saturation levels, okay? So I'm not sure if we did this last year actually, but I've got this little device called a pulse oximeter, okay, and that just clips on your finger like that. Obviously it doesn't work when you've got gloves on, but yeah. So let's just pop that on. Yep, and we're looking really for anything as close to 100% as possible. So kind of how well the oxygen is in your body, and the fingertips are a really good place to test this. Yep, 99. Perfect. Almost perfect. Okay. Great. Just pop that down. Okay, so speaking of moisturisers, I've got one to show you if you're interested. Okay. This is one that I use just throughout the day between patients, you know, wearing gloves and using hand sanitizer can be quite drying, so just in between patients I usually tend to pop on a bit of cream. It's actually a body lotion, but it's really good for hands, so if you wanted to just pop on a little bit now, you're welcome to. Or I could do it for you. Yep, okay. Yeah, so Dove Nourishing Body Care Intensive Lotion for very dry skin. So, yeah. It doesn't have to be that one. Can be any, really, as long as you're doing it, okay? So let's just get that rubbed in for you. Yep, the other hand. Good, and then rub them together. Perfect. Just get these off now. Okay, yeah, rub it in. Good. The next little series of tests, I need you to do a couple of things for me. Okay, so if you want to go ahead and stand up, and if we could just do a little bit of a balance test. So stand on one leg. So yeah, just pick up one off the floor. I'm doing it as well. Yeah, let's just try and hold this together for 5 seconds. 1, 2, 3, 4, 5. Okay. Switch to the other leg. And hold. 1, 2, 3, 4, 5. Good. Okay, you didn't fall over, so balance is good enough. If you could now walk from where you are over to the door. before? Yeah. Good. Okay, yeah, stop that. If you could walk back, but walk heel to toe, so we're putting one foot directly in front of the other. Yep, you've got it. Yep. Good. 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 Yeah, that was great. If we could now just do a little bit of movement of our muscles. So to start with our hands, squeeze them tight into fists, then spread them apart. Yeah, so thumb tucked in, and then thumb on the outside. Okay, that's good. If you could go through each finger, just give it a little flex, just like I am. Yeah. Any stiffness or pain when you're doing any of that? No? Okay, let me know if any of the next exercises cause you any stiffness or pain as well. Alright, so I might just take this off. Alright, so turn your head side to side as far as you comfortably can, so don't hurt yourself. Good, and then again chin to chest. And then nose up to the sky. Yeah, good. And then your head in a circle. And the other way. It's like the start of a yoga lesson, kind of. Or like when you're like in PE at school. It's a bit like that. Okay, so no pain, no neck stiffness. Good, good. Okay, how about shoulders? Any problems with those? Good, okay, so we're going to lift them up and then drop them down one at a time. Good, and roll them back in a circle. Good, and forward. Good, and just checking, was there any pain, discomfort, or a sensation of tightness? No pulled muscles. Okay, good. If you wouldn't mind bending down to the floor just to touch your toes, it's okay if you bend your knees. Yep, you can come back up. Good. And then arms up high. Bit hard to do it in this doctor's jacket, but arms up high, stretch to the ceiling. Okay, now keep your feet, come back down, keeping your feet firmly planted. Okay, your hips forward. I just want you to turn at the waist, so we're twisting at the middle. Hips are forward, just twisting at the waist. Okay. Yeah, keep doing it. Just gonna have a look at you. Any pain or discomfort in your stomach or in your back when you're doing that? No. Okay, good. Okay, so just with your arm, just gonna be bending at our elbow. Other side. Is that okay? Yeah, and then bend your knees and a little bounce. Okay, good. Pick up one leg, bend your knee, give your leg a little shake. And the other side, pick up and feel like a little shake. Perfect. Okay, so all seems to be in working order. Right, so we can go ahead now and move on to the fun part, the part that is most popular among my patients, which would be the eye test part. You did say that you've been for an orbital exam recently, so your eyes will have been very, very thoroughly tested. So we'll just do a couple of quick tests now. So I'm just going to switch on the light and just have a look at your pupils. So just kind of stare blankly ahead, either at me or at the wall. Lots of posters up there. We've got a poster of an eye, an ear, the internal human body, and the skin, like layers of the skin. So whatever takes your interest, just stare ahead at that. Okay, so I'm just going to be bringing this into one eye at a time and having a look at the quality of your pupil dilation. Okay. Good. Good. Okay. Good, other side. Yeah. It's important when I'm doing this to look at the eye that I'm shining the light in, and then also the opposite eye to check that it's responding the way it should be. It kind of gives us an indication of whether the brain and the eyes are working together as a team. Okay. Left eye, right eye, left eye, right, left eye, right eye. Okay, what we'll do is maybe a little bit of tracking, following the light. It's a favourite. Okay. So, yep, just you can look at the light with both eyes if that's alright. Just follow it. Just gonna move it around in front of you. Good, you are keeping your head still, I forgot to say, but you know the drill by now. So yeah, head still, just tracking with our eyes. Just kind of testing the different positions of gaze. So top left, bottom left, top right, bottom right, top middle, bottom middle. Okay. Turn that off for a moment. We'll do one more eye test, okay? I can see that you are wearing glasses, and that's absolutely fine. Have you had your glasses checked over recently? Yeah, how long ago? That's fine, okay, yeah, that's good then. Alright, so I'm thinking what we'll do is cover one eye. So if I'm going to cover my right, then you cover your left. Okay, and if you just look at my nose and just with our peripheral vision, just tell me how many fingers I'm holding up. One, good. apologise. Again, just looking at my nose. 3, 1, 4, 5. Perfect. Alright, all good. So we don't really need to go in much more detail with your eyes because you've been to the opticians, the eye doctor, twice recently. Once for new glasses, as you said, and once for the orbital exam. So I'm sure if there was any problems that they would have picked up on that. So we'll move on now to your ears. And have you had any difficulty hearing me in this session? I've been quiet. Okay, good. Have you had any difficulty hearing in your day-to-day life? Has anyone commented on that? Yeah. Okay, so you have had to ask people to repeat themselves. Do you find things like the volume on the TV, do you find that you need it louder than other people? Alright, okay. So, yeah, I'll just do a couple of tests with you today. So, I'll do what is called the whisper test. So, I will whisper some words or numbers in your ears to each one individually. So, we'll cover the opposite one. And then I'll use my otoscope to have a look in your ears. Okay. It's been a while since your last hearing exam, hasn't it? Yeah, so we might be due for another one anyway, so don't worry. Alright, so I'll just begin to whisper 3 or 4 words on each side, okay? Scarecrow. Okay. Rainbow. Okay. Blanket. Jacket. We'll do number not too bad. You missed a couple of words generally in this ear, but this ear you were spot on. So I'm just gonna go ahead and with my otoscope have a look in each ear, okay? Alright, so if you turn your head a little. Okay. Just having a look around the exterior. Can you feel that? Yeah. Just gonna pull down on your earlobe. Yeah, this is looking good. It's looking behind your ear now. Okay, good. I really ought to be wearing gloves, but they're covered in moisturiser, so I hope you don't mind. Alright, let's look on the other ear then. Good. Just gonna pull down that lobe. Okay. Yeah, everything looks fine. There's no redness or inflammation. Not that I can see. I think what we'll do is refer you on to the audiologist for a detailed ear exam and hearing exam, because they can use some special tools that I don't have access to, so a tuning fork, and they've got these very cool soundproof headphones which they can play sounds through. So I will make you an appointment. Would next week be okay? Yeah, any day that's good for you, but we do want to get this looked at straight away, okay? So your ears looked great, but you did seem to have a tiny bit of weakness maybe in that side. Alright, don't worry, we'll get it sorted. Okay, last thing really, have you had any issues with any of your other senses? So your eyesight is okay, your hearing we've talked about, so taste and smell, have you noticed anything with those? I can refer you to a detailed taste and smell test. It's an optional test, it's not something that is routine. It's quite relaxing and enjoyable, so many patients just, they like it for the experience, so we could book you in for that if you think it could be necessary or if you just fancy it. Okay, and touch can be hard to judge. Okay, so if I take the back of my hand, just lightly touch it, different areas of your face, and you just tell me when you can feel the sensation, okay? Good. Yep. Good. Yep. Good. 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 Okay, if we do similar, if you tell me which side is firmer and which side is softer, so one side will be a firm touch, pressing in a little bit, and the other side will be just ever so slight touch, okay? So just say which side is firmer. Yeah, right. Left. could do similar on your hands. Yep, so if I take your right hand, just the back of your hand, try not to look away, and just say light, firm, light. Okay, the other hand, light, firm, light. Okay, perfect. I will actually just quickly have a look in your mouth, okay? I'm not going to touch though because I'm not wearing gloves, so if you open your mouth up wide, okay, let's have a look in there. When was the last time you saw a dentist? Yeah, okay. If you could bite your jaw, like clench your jaw, bite your teeth together. Any issues with your teeth, say when you're eating hot food, eating cold food? No? Eating hard food, like do you chew a lot of sweets? Okay, good. Alright, everything seems to be fine then, so don't forget to pop over to the pharmacy on your way out to get that special shampoo. And also you can book in for whichever day is suitable to you your hearing test for next week. But other than that, you're all in working condition. You're doing really, really well, so that's great.